Congratulations on your new set of braces. This oral hygiene video is going to go over some simple steps that you can take in order to care for your teeth while you're in braces. It's really important to ensure that we control the plaque, biofilm around those dental brackets and your marginal gingiva, because that might lead to enamel decalcification, which can be seen in white spot lesions and gingival disease. So brushing and flossing is really important with orthodontics, and here we are going to take a look at an oral irrigating device. So when you are using an oral irrigating device, you want to make sure that you set it up to be on a low power, and we are going to be directing the flow perpendicularly to the long axis of the tooth and not directly into the gingival sulcus. You are able to purchase additional tips for the water pick that are Ortho tips, which makes it a little bit easier to get in and around those brackets. You can also add antimicrobial agents into the irrigator reservoir, or you can use those as a mouth rinse, which will help with plaque control as well. When it comes to toothbrushing, a powered toothbrush is going to be your best friend for getting in and around those brackets and wires a lot easier, but you can use a manual toothbrush as well. The method we are going to be using is called the Charters method. So you are going to take that electric toothbrush and you are going to angle it down on top of your brackets, okay? So you are going to sit just on the gingival margin, angling it down towards the top of your brackets, making sure that we are getting the total of the tooth at the top. And we are going to do the same on the bottom, except you're going to cover the incisal edge or the end of your tooth, the biting surface, and angle the brush up towards your brackets. Depending on your toothbrush, there are specific orthodontic tips that you can get that will make it a lot easier for getting in and around the brackets and making sure your teeth stay clean. If we don't have access to an oral irrigator, another product you can use is called Super Floss. So Super Floss is just like regular dental floss, except we have this harder plastic end on a string of floss. So this is going to make it a lot easier for you to get under the wires of your braces, thread that through, and then we are going to perform a normal C-shaped flossing method. So making sure we get into the sulcus, both sides of those teeth, and then we are just going to pull the floss through or back up the other side and go through to the next interproximal area. Yes, this can be a little bit time consuming. However, this is a super easy method to maintain that C-shaped flossing that we've been talking about at your regular dental appointments. So this next product here, this is a floss threader. So a floss threader is a little bit similar to that Super Floss. This is going to be a plastic piece of material with a loop on the end of it, okay? So what we are going to do is we are going to take a piece of regular floss. We are going to thread it through the floss threader, almost like you are threading a sewing needle. And that piece of the floss threader is a harder plastic. So just like we looked at with the Super Floss, this is going to make it a lot easier for you to get in between those interproximal areas underneath that wire. So we are just going to thread it through, grab it on the other side. And once we are in, we are going to perform your normal C-shaped flossing technique, making sure we're getting into that sulcus on both sides of those teeth that we just threaded through. We're going to pull through, and then we would repeat in the next interproximal area. So this product here, this is called an Ortho pick, and it looks really similar to those floss picks that you are probably used to using. However, this is designed so that one side of the plastic can actually fit up and under the wire of your orthodontics so that you can get into that interproximal space and perform your regular flossing routine. And you are able to use these on both the maxillary and mandibular teeth. Just make sure that you are rinsing the floss in between each tooth, okay? So every time you're entering an interproximal space, you're gonna enter the space, and then you're gonna rinse the floss, and then we're going to move on to the next interproximal space. The next product we're going to take a look at is a soft pick. You've probably already used these, and we are going to use them in the same fashion with your new orthodontics. So we can just slide that soft pick into between the teeth on top of the wires, and one by one we can perform our interdental cleaning. We can use these on both the maxillary and mandibular teeth, and it is a little bit easier than threading that floss threader or the super floss through your teeth. One other product we need to remember to use is fluoride. So the presence of orthodontic appliances is a risk factor for dental caries. Daily fluoride therapy is essential preventive care for the orthodontic client. In addition to a standard fluoride toothpaste, a fluoride rinse or gel should be used daily at home. However, the effectiveness will depend on your compliance. Sugar intake should be minimized during the period of active treatment. Moreover, even though orthodontic bands and wires are made of metal or porcelain, they can be fragile and damaged by eating the wrong foods. So, foods to avoid: chewing gum, sugarless or otherwise, sticky foods like peanut butter, sticky candies such as caramels, and hard foods. So nuts, corn on the cob, popcorn, hard candy, bagels, apples, anything that could be hard and too crunchy and could damage those brackets or wires. And we also want to make sure we're not chewing on ice. Foods to make sure that we do include are foods low in sugar, fresh fruits and vegetables cut into pieces, applesauce, yogurt, pastas, and representatives from all areas of food groups cut into pieces if needed. The biggest thing here for nutritional considerations is that we want to make sure that anything that we're eating can be cut with a fork and knife and placed directly into the mouth, and you do not need to bite anything with your brackets. Thanks for checking out this video on oral hygiene for your new orthodontic appliances. Using a lot of these tips and tricks in this video will help make sure that we keep your teeth and gums nice and healthy while we give you that beautiful smile.